If you've ever woken up one morning, looked in the mirror, and thought, help, my face is falling, you are not alone. You are probably just in middle age. I'm Dr. Alice Mina. Welcome to my channel, The Skin Real, where I give real people real information about their skin health so that they can make informed decisions. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways from my recent podcast interview with Dr. Brenda Dintiman. Now, Dr. Dintiman has been a practicing board certified dermatologist for over 30 years, and she really had some true insights into menopause and skin aging, not only as a woman who has experienced it, but also as a dermatologist who used to practice back in the 90s and early 2000s when women were on hormone replacement therapy. It was a super enlightening episode. If you are a woman going through menopause, or really just a woman who will experience menopause, hopefully, you would definitely want to check out the full episode, and I will link it at the end of this video. Now, menopause, I feel like, is this four-letter word that we say no woman is really excited about it. It makes us feel old to say it. In a lot of ways, at least for me, I feel like I dread it a little bit. And I feel like women who are menopausal or postmenopausal are just kind of forgotten about. But all of that seems to be changing. And I think it's a really exciting time to be a woman. We are finally talking about what happens to women's bodies during menopause and all the effects that a lack of estrogen causes, not just in our skin or GYN organs, but really with our brain, heart, every organ imaginable. And since we are living longer and longer than ever, it's super important that we understand this, because there may come a time, and maybe my daughter will actually spend more of her life in postmenopause than she actually does in the reproductive years or earlier. So finally, it's being talked about. Now, I just had a really great podcast episode with Dr. Kelly Casperson about hormones and menopause. She's a urologist. If you are interested in taking a deep dive into all of that, definitely check out that video as well. But on this recap episode, I just want to break down what happens to our skin during menopause, because I am a dermatologist. Now, a lot of my patients come in and say, I feel like I just aged overnight, and they're not going crazy. Our collagen is actually dropping by about 1% every year after our mid-20s. But once you hit menopause, there is about a 30% drop in your collagen all of a sudden. And it can really make an impact in our skin and how we look. And it can feel like all of a sudden your body has just given in to gravity. Another issue that happens during menopause is the skin gets really, really dry. We know that estrogen helps retain moisture, helps prevent transepidermal water loss, and protects our skin barrier. And so when we don't have estrogen during menopause and postmenopause, our skin can be very, very dry. That can also make fine lines and wrinkles more prevalent. And also, our skin can be more sensitive than ever before. And unfortunately, hormonal acne can rear its ugly head again. Perhaps you thought acne was just for teenagers, but it can really happen from newborn to old age. And we believe that this could be due to fluctuations in our hormones. As the amount of estrogen goes down, our relative ratio of testosterone in our body is higher. And so some women may experience acne in their 50s, 60s, and beyond. Now, here's one I see a lot, and I'm even experienced it myself, and that's hair thinning. I'm not talking about the hair shedding that happens after pregnancy. I'm talking about that thinning where all of a sudden you look in the mirror and you feel like, I can see more of my scalp through my hair, or perhaps your part has gotten bigger or wider. You are not going crazy. This is common. Estrogen helps keep our hair healthy on our heads. And again, when you lose that estrogen and then you have a relative imbalance in testosterone, frequently women will notice hair thinning just like men do. And then lastly, during menopause and postmenopause, this is when we see a lot of the ramifications from sun damage that builds up over the years. I treat a lot of skin cancers and precancers, and we know that skin cancers are due to sun damage that is cumulative. So it's during these later decades of life that we see the damage kind of rear its ugly head. So this is another great reason to see your dermatologist for skin checks to make sure that you don't have anything worrisome or a precancer or skin cancer on your skin. So these are the things that happen. They are natural, but there are some things you can do about it to help minimize some of the less desirable effects of menopause on our skin. Number one is moisturize. As someone who used to have very oily skin, I did not moisturize. My sunscreen typically was my moisturizer. But as I'm getting older, I notice I need to increase hydration. And I know that when I'm in menopause and beyond, I will definitely have to bump up the moisturization to really help my skin hold on to that. Moisturized skin always looks healthier, more refreshed, plumper, and will help minimize fine lines and wrinkles. Number two, embrace retinols and retinoids, even if you haven't used them before. I think sometimes people are worried about starting these in menopause because they feel like their skin is already dry, but you can use these safely without irritating your skin. I did a great podcast episode with Dr. Chang on that, so you can check out the details there. You don't have to use a lot. You don't have to use a strong prescription, but it is a great option to help boost collagen, improve fine lines and wrinkles. And if you're struggling with acne, it will also help with this. Sunscreen is a must always and forever. You want to continue to use your sunscreen through all stages of life. Do not skip this important step. For hair loss, we actually have a lot of options nowadays, which is wonderful. So postmenopausal women can be on some slightly different medications than women who are in their reproductive years. So definitely talk with your dermatologist about some medications that can help. Things like spironolactone, minoxidil, dutasteride. These are all great options. And many of them come in topical versions as well as oral versions. And they're now even a laser that can help. LED light and injections like PRP can be helpful for hair loss. So talk to your dermatologist about this. Supplementation can be helpful as well. There are things we can do for that hair thinning that we commonly see in menopause and postmenopause. And then I definitely want to cover estrogen cream for your face. This is something I'm getting asked about a lot. We know that estrogen cream to the perineum, to the vulva, to the vagina is really helpful in increasing skin hydration, decreasing irritation and pain, and believe it or not, actually decreases the risk of recurrent urinary tract infections, which can be really severe in older patients. So people have been using their vaginal cream on their face for decades, but now companies realize there's an interest in this, and they're actually formulating estrogen cream specifically for the facial skin that can have a nice feel, that's elegant, and that will really bump up your hydration and moisturization. So definitely something that I think is worth considering if you're struggling with dry skin or you're in menopause. The good news is too that it doesn't appear to have any systemic absorption. So if you are worried about that, it really is not cause for concern. And then lastly, one of the most important things you can do for your skin during menopause is to take care of your body from the inside out. All those things like lifestyle, your diet, exercising, weightlifting, stress management, sleep, minimizing alcohol, not smoking, all of these things are so crucial, maybe even more crucial during this period of life to help keep us strong as we head into our golden years. And really, the best time to start is now before you even hit menopause or postmenopause. But again, it's never too late. So making sure you're taking care of your body from the inside out can be really impactful for your skin. And talk with your GYN or your primary care doctor to see if hormone replacement therapy is right for you. We're learning so much about how beneficial estrogen is in all organ systems and how devastating it can be for women to live for so many decades without it. So be sure to talk with your GYN or primary care doctor about that. Lastly, if you are still having some skin concerns, be sure to see your board certified dermatologist who can offer some insights into some in-office procedures that can help with your skin. Things like microneedling or laser resurfacing can be a great way to improve your skin complexion and to also help boost collagen and even reduce precancers and early skin cancers, studies have shown, as well as chemical peels are always a great refresh. I love things like Sculptra and Radiesse to help collagen bank. Again, just like with exercise and diet and lifestyle, starting before you really think you need it is ideal. But these products can help build your own collagen to help mitigate some of that collagen loss we see with the loss in estrogen. And there's so many other things too, depending on what your skin needs are and what your goals are. So see your board certified dermatologist. If you're struggling with symptoms of menopause in your skin, you are not alone. and there are things we can do to help you. If you want to hear the full episode, be sure to check it out here, and I will see you next week.